Imagine waking up one day to find your skin has a yellowish tint, or you can't shake off a persistent itch that seems to come out of nowhere. Perhaps you're feeling overwhelmingly tired despite getting plenty of rest. These are not just minor annoyances. They could be silent alarms from your liver, signaling serious trouble. If you notice these 6 unsettling signs, it's crucial to act swiftly and consult a healthcare professional. Ignoring these symptoms could mean missing the early warnings of severe liver damage that might require immediate medical intervention. Your health could depend on recognizing these signs and taking prompt action. Liver damage can manifest through several unusual signs that might not directly indicate liver issues. These symptoms include yellowing of the skin and eyes, jaundice. When your liver can't efficiently process bilirubin, a yellowish pigment, it can build up in your body, causing the skin and eyes to appear yellow. This condition, known as jaundice, is more than just a cosmetic issue. It can be an indication of significant liver dysfunction. Normally, bilirubin is processed and excreted through bile, but liver damage prevents this, leading to its accumulation. Jaundice is not a disease itself, but a symptom of underlying liver issues, highlighting the liver's struggle to perform its crucial functions. Unexplained fatigue. If you find yourself feeling persistently exhausted despite a full night's sleep and proper rest, this could be a sign of serious liver problems. The liver plays a crucial role in storing and releasing glycogen, a key energy source. When the liver is damaged, it can't efficiently release glycogen, leaving you constantly drained and unable to regain your energy. This kind of overwhelming fatigue isn't just about feeling sleepy. It may indicate that your liver is struggling to perform its vital functions. While this can be alarming, try not to panic. Addressing it early can help manage potential issues. Itchy skin. Persistent itching that doesn't seem to go away could be more than just dry skin. It might signal a serious liver issue. The liver's role in processing bile salts is crucial for maintaining skin health. When the liver is damaged or not functioning properly, bile salts can build up in the bloodstream and then deposit in the skin, causing intense and relentless itching. This kind of itching is often widespread and can become extremely bothersome, indicating a significant problem within your liver. If you find yourself scratching excessively and the itchiness doesn't subside, it may be time to investigate further. This symptom could be a critical warning sign that demands immediate attention. Dark urine. If you notice your urine turning a darker shade than usual, it's a sign that something might be seriously wrong with your liver. Normally, urine should have a pale yellow color, but if it starts to look brownish or amber, this could indicate a troubling issue. Dark urine often suggests that your liver is having trouble processing bilirubin, a yellow pigment that is usually filtered out of your blood and excreted through bile. When the liver is compromised, bilirubin can spill over into your urine, causing it to darken. This change in urine color can be a stark visual cue that your liver is not functioning properly. The darkening of urine could mean that toxins and waste products are not being processed efficiently, which may lead to severe health complications. If you see persistent dark urine, it's crucial to take this seriously and seek medical evaluation. Ignoring this symptom could lead to exacerbating underlying liver problems that might require intensive treatment. Pale or clay-colored stools. Changes in stool color can provide valuable insights into your liver health. Under normal circumstances, stools are brown due to bilirubin, a pigment produced by the liver. When the liver processes bilirubin correctly, it adds this color to your stools. However, if the liver isn't functioning properly, it may struggle to process bilirubin effectively. This can result in stools that appear pale or clay-colored, as the usual brown pigment is lacking. This change in color is an important sign that something may be disrupting the normal function of your liver. Pale or clay-colored stools can indicate a decrease in bile flow or an issue with bilirubin processing. While this symptom alone is not necessarily alarming, it's a good idea to pay attention and observe if this change persists. Monitoring such signs can help identify potential issues early, allowing for timely intervention and proper care. If you notice consistently pale stools, consider discussing it with a healthcare professional to ensure your liver health is thoroughly assessed. Bruising easily. If you find yourself getting bruises more easily than before, it could be a serious sign of liver damage. The liver produces vital proteins essential for blood clotting. When the liver is compromised, it struggles to produce these proteins effectively, leading to a higher likelihood of bruising from minor bumps or injuries. This increased tendency to bruise can mean your body's ability to stop bleeding and heal itself is severely compromised. Such frequent bruising might indicate that your liver's critical functions are under threat. If you're noticing unexplained bruises or those that appear with minimal impact, this could be a severe warning sign that needs immediate attention. Taking these symptoms seriously is crucial, as they may point to significant underlying liver issues that could escalate if not addressed promptly. Alcoholic and non-alcoholic fatty liver disease. In addition to the signs we've discussed, it's important to recognize that liver damage can stem from both alcoholic and non-alcoholic fatty liver disease, NFLD. Alcoholic fatty liver disease is directly related to excessive alcohol consumption, while NFLD is often associated with factors like obesity, diabetes, and poor diet. Both conditions involve the accumulation of fat in liver cells, which can impair liver function and lead to serious complications if left untreated. If you notice any of the symptoms we've covered and suspect you might have fatty liver disease, it's crucial to address the issue promptly. Early intervention and lifestyle changes can significantly impact the management and progression of both alcoholic and non-alcoholic fatty liver diseases. Conclusion. Remember, the signs and symptoms we've discussed today are crucial indicators that your liver may be in trouble. If you've experienced any of these, it's vital to take them seriously and consider seeking medical advice. Early detection can make a significant difference in managing liver health. For those interested in learning more about specific liver conditions, such as alcoholic and non-alcoholic fatty liver disease, be sure to check out my previous video where I delve deeper into these issues. Taking proactive steps towards understanding and caring for your liver is essential for maintaining overall health and well-being. Thank you for watching, and stay tuned for more informative